Hi, I'm Dave Renner, Director of State and Federal Legislation for the Minnesota Medical Association.
And I'm Eric Dick, the Manager of State Legislative Affairs for the MMA. We're here at the Capitol today to share with you our thoughts on the 2012 session, especially how it affects Minnesota physicians.
One of the bills we spent a significant amount of effort on was dealing with the Board of Medical Practice and providing information to consumers. Our focus has been trying to ensure that patients got information that was helpful to them, but that we also protected physicians from harmful information that may have been misleading. The final version of the bill resulted in more disclosure to consumers about, for all health licensees, regarding convictions of felony and gross misdemeanors, and also histories on malpractice judgments. One area we focused very strongly on was to remove any discussion of malpractice settlements, which we do not believe is a good indicator of quality and maybe is misleading as we provide that information to consumers. Another key bill that we worked on was dealing with provider peer grouping. This is the system that the state has set up to collect and report quality cost information on clinics and hospitals. The legislation this year clearly provides a chance for providers to review their own data before any public release, to be able to verify the accuracy of that data, to ensure that this is helpful data that will go out to consumers. In addition, the legislation creates a number of advisory committees for which the MMA and others will be able to participate to ensure that the data that is being provided is useful to consumers and will help clinics and hospitals improve their quality.
Another victory came in the form of newborn screening. We were pleased that the Minnesota Department of Health will be able to continue the program thanks to legislation that establishes a standard retention period for blood spots of 71 days for the spot and 2 years for test results. Practitioners use these blood spots to screen for more than 50 genetic and congenital defects and is an incredibly important program for public health. The legislation also allows parents to give consent for long-term storage, up to 18 years, of the spots and test results, as well as permitting researchers to use the spots for new test development. The 2011 session included a lot of healthcare cuts. This year, in 2012, lawmakers restored some of that funding, specifically $18 million to the Health and Human Services budget. It came in the form of additional funding to programs and a call for several new studies. Those receiving funding include personal care attendants who take care of sick relatives and emergency medical assistance patients on dialysis and cancer care. Among the studies are a new study on autism in the Somali American community conducted by the University of Minnesota, a study of methods to better protect patient records from unauthorized access and release, and a study on the prepaid medical assistance program known as the PMAP program.
While there were many good provisions in the budget bills that passed, we were disappointed in two items that were not included. One was restoration of cuts that were made in 2011 for the Medical Education and Research Costs program. This is a program that funds residency training sites. Secondly, there were no increases in provider payments for our public programs. Again, in 2011, these payments were cut by 3%. We were hopeful but disappointed that some of those cuts, that those cuts were not reinstated in 2012.
Among the disappointments this year as well was a bill that did not move forward, and that is the Minnesota Insurance Exchange. A Senate bill went down to defeat in committee in March, and no proposal was sent to the governor. We at the MMA will continue to work with Governor Dayton and with legislative leaders on putting forward a Minnesota-based insurance exchange. Another bill that did not move forward was a physician firearm gag bill. Under this legislation, physicians would be prevented from asking their patients whether there are firearms in the home or whether a patient has access to firearms. We argue to legislators that physicians need to be able to ask all the questions they feel necessary of a patient to protect that individual's safeties. We were pleased that this bill did not move forward in the 2012 session.
And finally, we were glad that the legislature did not adopt legislation that would have modified our current Minnesota minor consent law. This law allows physicians to treat minors for certain conditions related to chemical dependency and reproductive health without the need for parental consent. Now that the 2012 legislative session is over, we are beginning our preparations for 2013. This year is an election year. All 201 legislators are up for re-election. We've already heard a significant number of retirements, so there will be many new players coming back to St. Paul in January. The other issue that is impacting the 2013 legislative session is a projected deficit once again in the state's budget. Most experts are looking at a deficit of greater than $1 billion as we enter January 2013.
And with all those changes and with the challenges going forward, we need your help. Please do email us, contact us, call us, and let us know what is on your mind, what's affecting your practices, and even more so with the November elections, get involved, get to know your candidates, join MedPAC, and again, call us with any questions.
We hope this has been helpful to you. We appreciate your ongoing support. More than anything else, we thank you for your efforts as we continue to promote MMA's advocacy agenda. Thank you.